For today, I'm going to review the paper Pregabalin for the treatment of syringomyelia-associated neuropathic pain in dogs, a randomized placebo-controlled double-masked clinical trial. This is from 2019 out of the Veterinary Journal. It is not open source, so I will just be going through the abstract and then just giving some of my thoughts on the paper. So looking at the abstract, Pregabalin is the first-line treatment for neuropathic pain in humans. Dogs with Chiari-like malformation and syringomyelia-associated neuropathic pain could potentially benefit from Pregabalin. The aim of this study was to evaluate the efficacy of Pregabalin for neuropathic pain in dogs with caudal occipital malformation or syringomyelia. 8 dogs with symptomatic syringomyelia or Chiari-like malformation were included in a double-mass randomized crossover placebo-controlled clinical trial. All dogs received a nonsteroidal anti-inflammatory drug as baseline treatment during placebo or Pregabalin phase of 14 plus or minus 4 days each. Analgesic efficacy was assessed with a daily numerical rating scale recorded by dog owners and quantitative sensory testing at baseline, placebo, and Pregabalin phase. Blood samples were collected to report Pregabalin exposures and to assess renal function. Daily numerical rating scale scores recorded by dog owners in the Pregabalin group were lower than in the placebo group. The p-value is 0.006. Mechanical thresholds were higher in the Pregabalin compared to baseline or placebo, with the p-values of 0.037 and p of less than 0.001. Cold latency at 15 degrees Celsius was prolonged on the neck and humeri with Pregabalin compared to baseline. P-values less than 0.001 for both, or placebo, with the p-value of 0.02 or 0.0001. Cold latency at 0 degrees Celsius was longer on Pregabalin compared to baseline and placebo. There was no Pregabalin accumulation between first and last dose. This study demonstrates the efficacy of Pregabalin for the treatment of neuropathic pain due to Chiari-like malformation or syringomyelia on daily pain scores recorded by owners. Pregabalin sufficiently reduce mechanical hyperalgesia and cold hyperalgesia and allodynia compared to placebo. Pregabalin was non-cumulative and well tolerated with occasional mild sedation. So just going through this study, my main takeaway is that dogs with neuropathic pain secondary to Chiari malformation and syringomyelia could do well with Pregabalin, and it seems that in a lot of dogs it does provide relief for neuropathic pain. Looking through some of the data, there's definitely overlap between the placebo and the patients that were given Pregabalin. So at least for me, my takeaway from that is that some patients aren't going to respond as well as others. And from just my clinical experience, I would say that that's the reality of the situation, and that's going to be how it is for most medications. And there's some dogs that are placed on Pregabalin that seem to have a very good response, and there's some patients that you put on Pregabalin and their pain is still persistent. I think that the majority of patients that I've used this medication on have an overall good response, but there are some that unfortunately the medication causes sedation and nothing else, and we end up trying a different medication, a lower dose, or a different combination of medications. This paper did come out in 2019, and Pregabalin has been used more and more since then, and I think we have more clinical data compared to when this paper first came out that the medication seems to be safe, and again, most patients seem to have a decent response to this. So overall, again, I think the study's well done. This kind of study is extremely difficult to design, recruit, and perform. So I definitely applaud all the efforts for this study. And again, I think it gives us very valuable information. but there's only 8 dogs included in this study, so despite being a blinded study, it's going to have the limitations of there could be some degree of statistical error because of the small sample size. As far as the methods that were used in trying to assess for pain, there's always going to be limitations in how well we're able to assess pain in dogs. The study does a very good job at trying to overcome a lot of those limitations, but there's always going to be some degree of subjectivity and variability when we're trying to assess pain in dogs. But again, I think the study overall did a very good job, and the references that they use as far as how they're going about trying to assess pain and why they chose what they did was very well done. One thing I will comment on is looking at figure 3. They state that the red triangles represent the pregabalin phase and the blue triangles represent the placebo phase, but there are no red triangles, there's red circles, so I'm assuming that they mean red circles. That's just something that I noticed. And if that's the case, which they do say the red line represents the mean for the pregabalin group, it is lower. Another thing worth mentioning is the daily pain scores were recorded by the dog owners, and anytime owners are involved, there's going to be the argument that this isn't the best scale to use, or this data is not the best, just because owners don't have the training of veterinarians or neurologists. So unfortunately, that's always going to be a drawback of a study designed this way. But because it's double-blinded and the scale was used in both groups, in theory, it should take out any sort of inherent bias in these patients. But again, something worth mentioning that part of the scale for the pain assessment was done by the owners. Going back to the aim of this study was to evaluate the efficacy of pregabalin for treatment of canine neuropathic pain in a randomized placebo-controlled double-masked study. They hypothesized that pregabalin would demonstrate a superior effect on pain assessment outcome compared to baseline and placebo. And then they talk about the primary efficacy endpoints was this daily assessment pain score, which was recorded by the owners. And then their secondary endpoints were things that were done in hospital, such as the assessment for temperature threshold. I think that the study was able to answer the questions based on their aim and their hypothesis. So overall, it's well designed for what their goals were. One thing that I think is worth mentioning is they used the British Veterinary Association scheme for Chiari malformation and syringomyelia, and that's what's on the image behind me. So to be included in the study, they had to be a grade 2 for both Chiari malformation and for syringomyelia. So just to go through this real quick, for Chiari-like malformation, if they're grade 0, there's no Chiari malformation. A grade 1 is the cerebellum is slightly indented. And then a grade 2 is there's actually cerebellar herniation. For syringomyelia, grade 0 is normal. A grade 1 is central canal dilation, less than 2 millimeters. And then a grade 2 is a dilation greater than 2 millimeters or an obvious syrinx. So I think it's very reasonable that they use grade 2 as the cutoff, because there's no arguing that there's pathology present if grade 2 is present. All dogs had to have an MRI to be included in the study. So that's likely part of why there's lower numbers included in this study. Overall, though, again, good information. And that's all I have. Thank you.